Yeah, our third speaker is Dr. Tarani. As I introduced just now, she's also from the Faculty of Medicine at University of Malaya. Dr. Tarani, the floor is yours.
Good afternoon, and thank you for the organizers for inviting me to present in this distinguished panel. Okay, so as we all know, COVID-19 has wreaked havoc on lives and livelihoods. The common thread worldwide is that COVID-19 worsens socioeconomic disparities. The poor and the marginalized bear the brunt of health and social and economic consequences of the disease. In Malaysia, migrant populations are the most disadvantaged. Okay, while there are vaccines available, okay, these vaccines are limited, and they are for sure for now a scarce and precious resource. So how do we ensure that there are fair and equitable allocation of these precious resources? Today, I'll make a few points. Why are the migrant populations vulnerable? How should we prioritize vaccination? Okay, and who will pay for vaccination? And finally, what is the way forward? Okay, why do we focus on migrants? In Malaysia, officially it's about 3.2 million of the population, or 10% of our population is actually non-citizen. Okay, and the vulnerable population is what we're concerned about. The migrant workers who move for work, and the refugees and asylum seekers who who travel, escape from violence, conflict, and natural disasters. Okay, officially there are 2 million migrant workers in the country, but the undocumented workers are the problem because no one actually knows the total number. They are hidden. Okay, estimates are all we have, and the estimates are actually quite large, 2 to 4 million. Okay, refugees and asylum seekers are a smaller number, 180,000. But the problem with them is legally in Malaysia, since Malaysia is not a signatory of the UN Refugee Convention, refugees and asylum seekers are actually treated by the system as undocumented migrants. One assumption that people generally make is that migrants bring disease into the country, but especially for migrant workers, this is not true. A lot of them are healthy, they are of the productive age. When they leave their countries, they go through several health screenings, and in Malaysia too. But the conditions that they work and live actually can cause their health status to deteriorate. Okay, the caveat to this are actually refugees, asylum seekers, and people who are trafficked. So those people might be fleeing violence, and they would have physical and mental effects of that injuries. Okay, so why are these groups marginalized, and what are their vulnerabilities? Okay, for one, they are poor. Okay, migrant workers, the minimum wages in the country is like 1,002. Okay, so the conditions that they live in and work in basically prevent them from actually socially distancing and taking part in any of the SOPs to prevent the transmission of COVID. So they are at high risk. Then the social consequences to them of the disease, they are highly insecure in terms of jobs. During the MCO, the first people who are let go are undocumented migrants, refugees, and asylum seekers, because they don't actually have the right to work. We also hear of refugees being evicted, and food insecurity, unfortunately, still exists, and it exists a lot in refugee communities. Pre-COVID as well, there have been numerous barriers to accessing healthcare. COVID has exacerbated them. And the underlying racism and xenophobia that these communities experience have been worsened since the pandemic. This and documentation status actually prevents them from accessing healthcare and social protection mechanisms that Malaysians take for granted. So pre-pandemic, the barriers that exist are are present now and exacerbated. I think the main barriers would be financial barriers and affordability of healthcare, and the undocumented documentation status. In Malaysia, basically only documented migrants have access to health insurance, and that health insurance only covers things like emergency care and surgery in public hospitals. It's a very small amount, 20,000 ringgit. Outpatient care, preventive medicine is not covered, so it's up to the owners of the employer. Mostly workers pay for themselves. Okay, undocumented migrants, unfortunately, because of the immigration laws, public facilities check their documents, and this causes a fear in for them to come forward. Okay, there are other barriers like employer-related barriers. Most of these workers are daily paid. They are not given sick leave. They need permission to seek healthcare, so they do not go, and healthcare is sought at last resort. So COVID-19 among migrant population, we know it's happening, and what we had is great workplace clusters that actually seeded the third wave. Okay, our initial Malaysian government strategy with the MOH was very good towards providing healthcare, free healthcare. We had a circular out, and the common consensus at that time was not to take immigration action towards this population, but that was reversed in May, and undocumented migrants, including refugees and asylum seekers, were put into detention. So these clusters that happen is because of the conditions that they are in. The workplace clusters, I mean, basically you cannot, the conditions of living does not allow for social distancing and hygiene. Okay, and prisons and detention centers, they are closed environments. They've always been overcrowded, and this has worsened it, and breeding grounds for infection. So where can we intervene to improve the health of migrants? Is it the health sector? Is it occupational health and safety? Or is it border control? Okay, police or criminal justice? I mean, literally, it is multi-sectoral. The health department, MOH, cannot manage this as its own. We also have to think, is this a health problem or a security problem? And how do we engage policymakers, employers, and officials? Towards today's topic on prioritization of COVID vaccines, you know, the COVID-19 vaccine is a global public good, okay? But there's something like 7.8 billion people in the world and 32 million people in Malaysia. So how do we prioritize this limited, precious resource? It really depends on our societal values. Okay, in public health terms, vaccination especially, we look at utilitarian principles. That means maximizing societal benefits. We also look at the principle of justice or equity. That means fairness of distribution of benefits. Okay, another very important value is reciprocity. This is especially needed in this pandemic because you have people who are health workers and frontliners who are actually at higher risk of transmission because of the nature of their job caring for COVID patients. So we have a societal obligation to protect them. Okay? But all these decision making needs legitimacy. So we need appropriate, accountable authority, transparent decision making based on all the evidence that's available, and consulting society members, experts, and members of society. So yeah, the other speakers also talked about who gets the vaccine first, right? Is it the essential workers, healthcare workers, security workers, teachers, and so on? Okay, or is it those who get who are at risk of more severe disease and disability? Or is it the vulnerable population? Let me talk about the vulnerable population. The vulnerable population, like the migrants, but also those who are poor, those who are in conditions who cannot socially distance, like in prisons and so on, bear significant higher burdens of the pandemic. They basically, the disease that it affects them more, and they are unable to socially distance. This vaccinating these people is it adheres to the principle of justice, but also maximizes societal benefits, because if you prevent infections in that group, you will not prevent transmission to the rest of the population. Okay, so the WHO SAGE roadmap actually puts this group in stage 2. Okay. What are the public health justification for migrant refugee health? I mean, the first two principles of human rights and universal health coverage, that means giving healthcare for all, essential healthcare for all, despite ability to pay or citizenship, is sometimes called as ideal by a lot of policymakers, politicians. I think the economic benefits of protecting this group speaks more to politicians. I mean, these populations contribute a lot to society. Okay? Currently in MCO 2.0, two industries are allowed to work, and these are the construction and manufacturing industry, which is basically run by migrant workforce. Okay? Of course, it is cheaper for us to invest in prevention than treating the burden at the end. Okay? And very importantly, if we allow certain groups, vulnerable groups of the community that cluster together, who are not protected, we are actually allowing the seeds of infection to survive in our community. So it's not good for population health. I think a good example for this would be what happened in Sabah in December of 2019. So in 2019, we had the re-emergence of polio. So the first polio infection since 1992, and at that point, I was very upset because initially everyone was talking about vaccine hesitancy, but actually what was happening in Sabah was something totally different. Sabah has a large stateless community, and this community has barriers to access because they can't afford healthcare, and they are afraid that because of the undocumented status, they will be taken into health. A vaccination shot costs 40 ringgit. Okay, so after that, I mean, the Malaysian government with UNICEF and MOH and so on, they basically started going around vaccinating everybody. So it is born out of necessity. Okay? So international leaders, basically world leaders and NGOs, talk about the merits of vaccinating all people, because vaccination is actually a global public good, you know. And certain countries have prioritized refugees and migrants as a vulnerable group. Jordan, in the Zakari camp for Syrian refugees, have begun vaccinating refugees since last week. So that's a positive step. But in our country, I think a lot of people will ask, who pays for these vaccines? Okay, because we're talking about a group of non-citizens. Who pays? Is this our responsibility or not? I mean, a lot of people have asked me, my students have asked me, how do we go about it? Is it the government? Is it the employer? Is it the migrant themselves? Okay, so again, when we look at this sort of difficult decisions, we have to look at our values and priorities as a nation. I mean, as the government would have to think about how we should minimize damage to the health, society and the economics of the country. Okay, so
Dr. Tarani, is it perhaps if you could start wrapping up so that we can invite Prof. Norma to deliver her talk. But do wrap up.
Yeah, sorry, I didn't hear your alarm.
Yeah, sorry.
Yeah. So anyway, yeah, how do we prioritize this? Okay, so can we rely on the employers to provide vaccinations? I mean, I think the examples that we have to look for is the workplace clusters and non-compliance to employees' minimum standards for housing. Okay, and of course, workplace testing of migrant workers, which with SOXO, it's only been 10% of the population have been tested. Can the migrants pay themselves? So that's the question. Is it affordable? Will they actually go for it? And can we wait for that? Okay, so I will not go on to my last slide. I'll finish here and I'll open for questions later. Thank you so much.
Yeah. Thank you very much, Dr. Rani. That's a very enlightening talk with regards to the migrant workers. I would like now my colleague, Dr. Rahul, to introduce the next speaker. Thank you.